The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
Let's talk a little bit about what makes people decide that they need to seek treatment, right? What makes people decide that they need to go? Many people don't, whether it be medical or otherwise. Many people decide not to seek help. Why is it that some individuals won't show up to practice generally until it's too late? One of the reasons is because you have misinterpreted your symptoms, or you have negated the importance of your symptoms, right? For example, the person, oh, it's just a rash. Maybe the detergent I use is giving me a rash and therefore it's not an STD. I don't need to get a check. So you're downplaying the symptom, right? Noting that another reason why individuals may not necessarily want to seek help, it's they think, well, this is just silly. I'm going to waste all this time, have to miss school or work, and it's probably nothing. Maybe I have developed a rash because of nothing, right? Maybe it was the soap or the detergent or whatever, when in reality, that's important. Maybe calling out for a couple hours or being excused from class because you need to go to the doctor, that's okay, right? Not necessarily downplaying. And by the way, this applies to mental health too. I don't want you to think this is just physical. I'd argue this probably applies even more when it comes to mental health. Notice that a lot of cases, and I see this unfortunately a whole lot, is that I'll have a person showing up to the office and thinking, I'm just going to bother this provider. There's no point of me going to talk to this provider. I'm just going to bother her. I'm just going to bother him. Or a physician. I'm just going to go talk to them and just take away from their time. Maybe they should have been talking to someone who's really crazy or someone who is really sick. And my argument against that, even if you're the least crazy person that I have, does that mean you don't deserve help? So it's an invalid argument. I see this quite a lot, especially for people who are just starting mental health. I didn't want to bother you. I'm sure you have other clients to deal with. I mean, I suppose, but does that mean you're not worthy of seeking help? Right? So notice that a lot of individuals will get used to their routine and will be unhappy if they have to change their routine. And the last reason is that many individuals think, well, it's just a waste of my time. Now, let's think about what can we do to improve your communication with a healthcare provider. I would hope that you guys take this to heart because it is really difficult. I can only help you with the information that you give me. A mental health provider, a medical provider, we can only help you with what you give us, right? So if you don't tell me about your symptoms, if you don't tell me you're suicidal, if you don't tell me you're homicidal, if you don't tell me you're sexually attracted to children, if you don't tell me that you've been sexually assaulted, I can only work with what you give me. So it's immensely important that the person is able to communicate with their provider. Notice that some of the barriers that we may have can include your financial status. Notice that individuals who have less of that economic status have to have very brief medical visits. Another limitation is us, the actual provider, The actual provider may utilize terms that are not fitting for their audience, for the client, for their patient. When I first started working, and I was working at the prison, I was doing a lot of group therapy with the inmates. And part of internship is to be critiqued, right? That's the whole point of internship, is to be critiqued and learn. It's a process. And one of the critiques that I had was you need to tone down your jargon, because a lot of the information that you're giving these gentleman is being lost in translation. They simply don't understand that. And a lot of those gentlemen, unfortunately, won't have passed like a middle school education either. So I was making it difficult because of my own education, me thinking that I was doing something good for them. I'm actually not, because now I have to reevaluate, okay, how can I be more approachable in the sense of using language that could be understood? So sometimes that comes from our own end as practitioners. Sometimes patients forget to report your symptom altogether. The patient simply just forgets to tell you what's going on, right? They think that they knew exactly what they wanted to do. Sometimes it's important to just write it down. And I highly recommend that with my own patients. Please write down whenever you have a symptom, whether it be physical or otherwise, so you can relay this information to your medical provider, or if you can relay that information to me. A lot of individuals avoid help because they are terrified of having a serious diagnosis. I don't want to go see Dr. Shar because she's going to tell me I'm crazy. Chances are you're not crazy, but even if you were crazy, okay, does that mean you don't deserve help? So a lot of individuals avoid seeking help because they are terrified of what the answer may be. And lastly, and you may see this, I wouldn't say quite a lot, but you may see this every now and then, is that generally you don't want to listen to that person's authority. You don't trust the person's authority in regards to their experience, training, or education, and you simply are going to be dismissive of what the person's recommendations are. Ultimately speaking, a provider cannot force you right into treatment. Hopefully you can do this voluntarily, but a lot of people refuse to do treatment because, quote, there's nothing wrong with me, end quote. It's not me, it's my kid. My kid has an anger problem. It's not me, it's not us as parents, it's my child. You need to treat my child. Why do you want me to be in a family session? Well, because it's a family unit problem. It's not a child problem. So we need to address it as a family unit. And that comes from authority, because you have a person here who is trying to tell you and assist you with a family problem. But that takes away from your authority as a parent. So now you're resistant to treatment recommendations, which is let's start doing family therapy, right? So you'll notice that a whole lot. So any questions about that? Good deal. How can you improve SET communication? How can you improve SET communications? Plan your questions, please. Plan your questions in advance. Notice that please be accurate, right? If you have a rash and it stings, tell your provider, I have a rash and it stings, right? No, I have this thing, maybe, I don't know. Be as accurate as possible. Because like I said, we can only work with the information that we are provided. Notice that if you don't understand something, that's okay. That is quite okay. It's like me not understanding something about engineering, since most of you are an engineer. That's okay if I don't understand it. I need to ask you, right? So if you're talking about something about engineering, like, all right, so what is that? I don't know what that is. That's okay. The same goes for your provider. Your provider may say something that you're not familiar with. It's okay to ask questions. I have a lot of clients that do this with me, because sometimes I do speak Spanish fluently, but sometimes it is a little difficult to come up with certain words, particularly because Spanish only has about a third of the amount of words that you find in English. So just simply, some of the words just simply don't exist in Spanish. They simply don't. So sometimes it's a little difficult to communicate with them, and I'll know perfectly how to say it in English, but there's just not a term for it in Spanish. So sometimes my clients do ask for a clarification regarding what I just mentioned. Don't be afraid. Don't be afraid to voice your concern. This is your session, and this is the time in which you can ask for help with someone who is there to help you. Okay, so if you think the recommendation is not feasible, so for example, I had a client yesterday in which I recommended to her that we needed to start doing family therapy and not individual, because clearly it's a family problem. And she was reluctant at first. So it was good that she told me that. It was good that she said that she didn't want her mother and father in the session because, quote, every time dad gets angry, he tells me I'm stupid. He makes me feel stupid, so I think I can't say anything, end quote. So notice that it's fantastically okay for you to voice your concerns if there's something that you don't you don't think you can do. Notice that some of the things that you can do in order to adhere to medical advice, well, first of all, some people just simply don't want to. Some people just simply don't want to adhere to advice. Some people may simply not start treatment whatsoever. They simply won't start it. So imagine that I am doing an initial appointment with a patient, and generally initials are not an actual session. They're more like, okay, I need to get your background information, what's troubling you, family history, trauma history, medical history, right? So it's not like a sit on my couch and tell me how much you hate your mother type of session. It's more like me trying to get to know you. And then, okay, fantastic. We have your goals for treatment. We have everything, and then they don't show up. So they just don't start their actual treatment. Some individuals stop treatment altogether. And you're going to see this a whole lot in mental health. You're going to see a whole lot that people will simply stop treatment. One of the reasons that people stop treatment in mental health, it's funny, but it's because they're actually doing good, right? They start feeling better and they'll say, I don't need to see my counselor, I'm doing great. No, this is when you actually need to stick around because now it's working. I know we need to maintain it, right? Now when you're in a good baseline, now this is when you really need to go because we really need to sustain this, but they start feeling better, so they just stop going. Right? The same happens with medication. You prescribe antibiotics and your physician tells you need to take these for 3 weeks. And by week and a half, you're like, I feel great. I don't need to take all these antibiotics and just throw the rest of them away. It's the same with mental health. People start feeling better and then they stop attending their sessions. It happens quite a lot, actually. You start doing a good job and then they don't show up. So it does happen quite a lot. Notice that an individual, by his or her own accord, will start to reduce or increase what they were instructed to do. So for example, your physician, your psychiatrist told you, you're gonna take 100 milligrams of this medication, and you're like, I don't wanna take 100, let me do 75. Or I don't think 100 is gonna work, let me do 125. Notice that this was at your own accord against medical advice. The same thing goes for mental health. We're doing exposure therapy, and I recommended that you go and leave your house to reduce PTSD symptoms and anxiety. And I recommend that you leave your house at least twice a week for 30 minutes. Like, I'm gonna do it once a week for 15. Or I'm going to go every day for 3 hours. So you're not following along with the treatment that you were prescribed. And some people simply are inconsistent. Some people are simply inconsistent in order to follow treatment procedures. Now, there are many reasons why your patients or your clients are non-compliant. There's many reasons why they can be non-compliant. This is a very short list, but there are many reasons why a person may be non-compliant. Some people simply forget. Some people just, especially my ADHD patients, they just simply forget. Like, whoops, I was supposed to see you. I was supposed to go to your appointment. I was supposed to go to my psychiatrist. I was supposed to take my medication. Some people may simply forget. Another reason why people stop adhering to medical treatment, lack of social support. So what's the point? What's the point of me doing better if nobody's gonna care, right? So that's something you will see a whole lot. Some people fail to understand the instructions. Now, in regards to the difficulty of level of instructions as well, I don't want you to think that this is just the patient. This can come from the provider. It is your responsibility to ensure that your patient and your client does have a significant understanding of the instructions, right? That they know what they're getting themselves into, whether medical treatment or mental health treatment. It's part of your ethical and legal responsibility to ensure that this individual does understand the risks and benefits of their treatment. And lastly, just having a plain old negative attitude towards the physician or that provider. I don't want to do what Dr. Shar told me to do. I don't think she knows what she's talking about. I'm going to go seek another provider, right? So simply just a negative attitude towards help.